Antimicrobials including antibiotics, antivirals, antifungals, and antiparasitics are essential for treating infectious diseases in humans, animals, and plants. Their widespread use, however, has contributed to the emergence of antimicrobial resistance. Patterns of usage. Human health antibiotics are used to treat bacterial infections like pneumonia, tuberculosis, and urinary tract infections. Overuse and misuse, such as for viral infections like the common cold, contribute significantly to resistance. Veterinary medicine. Antimicrobials are used to prevent and treat diseases in livestock and aquaculture. Growth promotion practices, which are banned in some regions, have further accelerated resistance. Agriculture antimicrobials are sometimes used to control plant diseases, though usage is lower compared to other sectors. Key trends. Low and middle-income countries are experiencing rising antimicrobial consumption due to increased accessibility and urbanization. In high-income countries, efforts to regulate and reduce usage are more advanced. Antimicrobial resistance, AMR status. AMR occurs when microorganisms evolve to resist the effects of antimicrobials, rendering treatments ineffective. Current global status, multi-drug-resistant pathogens, bacteria like Escherichia coli, Klebsiella pneumoniae, and Mycobacterium tuberculosis have developed resistance to multiple drugs. Superbugs pathogens resistant to last-resort antibiotics such as carbapenems and colistin are increasing. Regional variation. Low and middle-income countries often report higher resistance rates due to unregulated antimicrobial use, lack of surveillance, and poor healthcare infrastructure. High-income countries face resistance due to overuse in healthcare and agriculture despite stronger regulatory frameworks. AMR hotspots. Healthcare settings with poor infection control, areas with high agricultural antimicrobial use, urban centers with limited sanitation. So, let's talk about the consequences of antimicrobial resistance, or AMR. Health impacts are significant. Increased mortality is a major concern as common infections and even minor injuries can become life-threatening. Prolonged illnesses and extended hospital stays are also on the rise, and for immunocompromised individuals, treatment options become severely limited. Moving on to economic consequences, higher healthcare costs are inevitable due to prolonged treatments and the need for expensive second-line therapies. There's also a loss of productivity from prolonged illness or tragically premature death. The agricultural sector isn't spared either, facing reduced livestock and crop yields. On a global scale, AMR poses a threat to achieving the United Nations Sustainable Development Goals. Particularly, it impacts goals related to health, which is Goal 3, poverty, that's Goal 1, and food security, which is Goal 2. Now, addressing AMR requires a multifaceted approach. Let's delve into some key strategies. First, stewardship programs are essential. These programs aim to optimize antimicrobial use in both human and animal health. Enhancing diagnostics to ensure appropriate prescriptions is also crucial. Next, surveillance and research play a vital role. Strengthening global and local AMR monitoring systems is a must. Investing in research for new antimicrobials and alternative therapies is equally important. Then, we have regulatory and policy measures. Banning non-therapeutic antimicrobial use in animals is a step in the right direction. Enforcing prescription-only policies for antimicrobials can make a big difference. Public awareness and education are also key. Campaigns to reduce misuse and overuse of antimicrobials are needed. Promoting hygiene and infection prevention measures can go a long way. Lastly, international collaboration is crucial. Coordinating efforts through organizations like the World Health Organization, the Food and Agriculture Organization, and the World Organization for Animal Health is essential. Sharing data and resources globally will help in the fight against AMR. The rising threat of AMR demands urgent, coordinated action across human, animal, and environmental health sectors, embracing a One Health approach. By addressing misuse, enhancing surveillance, and promoting innovation, the global community can mitigate AMR's impacts and safeguard the efficacy of life-saving antimicrobials.